My journey started in 1991. I had retired from the military and was working as the Human Resources Director for the American Bar Association in Chicago. My wife suggested that I go see our family physician because other family members had gone, but I had not yet met him. I'm a private pilot, keep my license valid. I have to get a flight physical every 3 years with a flight surgeon, had done that religiously and didn't really see a need to see a local family practitioner, but because of my wife's insistence, I did go. This was in 1991, and the family practitioner arbitrarily included in the blood work something called a PSA test. No discussion, no review was made with me before that test was included, but what came out was a number 10. And in those days, 4 was a magic number. Anything under 4 was you were okay with your prostate. Over 4 was suspect and would probably lead you on to be referred to a urologist. And I was referred to a urologist. Urologist did a biopsy and then found cancer and found a Gleason score of 7. And on a rating between 1 and 10, 7 put me a little bit above the mid-range. My urologist was kind of unique back in 1991 because he said, you know, I want you to go talk to a radiologist and get a second opinion because they look at the world differently than I do. And I also want you to go to oncologists because they deal with all kinds of cancers. And I also suggested you go up to Mayo Clinic because they're doing a lot of prostate cancer surgery up there. And I think it'd be good if you see what they have to offer. And here I am in Chicago, world-renowned medical facilities, outstanding specialists. But my urologist said, you know, they're doing something special at Mayo Clinic, which is in Rochester, Minnesota, 5 hours away. And he suggested I do that. And I did that. And I think this is important because one of the problems we have with prostate cancer is the silo effect. Because we have no gold standard, the good news is we catch the disease early. The bad news is we catch the disease early and there's a multi-options of what could be done. And one treatment, as you look at the results, 10 years on the pike is no better than another treatment. So it's kind of left up to the patient as to which way he wants to go. And in my case, I was fortunate because my urologist said, you know, surgery wasn't the only way, there was other ways, and he wanted me to investigate all those avenues, which I did. Well, I fell in love with the Mayo Clinic and decided to have surgery there. I knew I was at the right facility because there was a sheik from the Middle East a couple of doors down from me. He had his private 747 parked at Rochester Airport. His staff had taken over the top floor of the Ramada Inn in Rochester. And he had a bodyguard sitting outside his door. So I knew it was good enough for the sheik, it was good enough for Jim Williams. Well, I had a successful surgery at the Mayo Clinic, but they were very aggressive. The surgeon stated that he looked at the lymph nodes and he looked at the prostate bed, and that's always where the cancer goes when it matriculates or metastasizes. Leaves the prostate. He didn't see any there, but he said there might be some microscopic cancer because there was positive margins. In other words, where they resectioned the prostate, they saw some cancer. So he suggested, and I agreed, that we should go also on hormonotherapy. So not only did I have a radical prostatectomy, but I was on hormonotherapy for 6 months. The results of that aggressiveness back in 1991, I've been cancer-free for 31 years. And to tie it all into a bundle, being retired military, I had a healthcare plan called TRICARE for Life that covered most of the expenses. Now, so I had a perfect storm. And you would think that this would be the normal standard for treatment of prostate cancer in America. And I found out that it wasn't, that my path, my journey was unique, was not the standard. And so that started my advocacy journey.